March this year, Kenya welcomes her first batch of 1 million doses of the Astrazeneca COVID-19 vaccine.
What we have received here is equivalent, metaphorically speaking, to acquisition of machine guns, bazookas, and tanks to fight this war against COVID-19.
The country's first line of defense against COVID-19 now seems to be running out of its firepower, this with the COVID-19 surge in India. The first batch of an initial allocation to Kenya of 3.56 million doses by the COVAX facility came from the Serum Institute of India.
We also have a challenge because you all know of the Indian situation. The Serum Institute of India is a main producer of the Astrazeneca vaccines, which we have been using in Kenya, which we are continuing to use in Kenya. And therefore, the challenge is huge because obviously everybody knows what India is currently going through, unfortunately, and that has impacted on the ability of the countries under the COVAX regime to be able to continue vaccinating their people.
India has been forced to restrict exports of the vaccine following the unfolding crisis in the country. African countries, Kenya included, were depending on vaccines donated by the World Health Organization through the COVAX facility. Health Cabinet Secretary Kagwe now says the country will seek alternatives.
Kenya is taking other steps as well. We have gone on the Africa platform to acquire also other vaccines, particularly Pfizer and Johnson & Johnson vaccines. And this is essentially to back up and to support what we would be expecting to get from the COVAX facility.
Until then, the East African nation is taking steps to keep new strains out of its borders.
And given the situation, resolved to suspend all passenger flights in and out of India into Kenya for a period of 14 days, subject to review.
By Wednesday, the East African nation had vaccinated just over 800,000 persons. Sarah Kimani, SABC News, Kenya.